When you hear a cancer diagnosis, you expect physical symptoms like fatigue or nausea. What catches many families off guard are the sudden emotional shifts. Some patients experience drastic changes in mood and personality, a phenomenon researchers call the Breaking Bad effect. It is easy to take these changes personally, but they are often rooted in biology, not character flaws. To manage this, grab a pen and paper. We are going to build a concrete communication and care action plan. Acknowledging the unseen biological reality of these behavioral shifts is your first step to moving away from resentment and towards structured management. Step 1 of your plan is understanding the cause. Start your list by writing down the biological triggers. Both tumors and the treatments used to fight them can release inflammatory molecules known as cytokines. These tiny inflammatory cytokines travel straight through the patient's bloodstream, where they can directly affect their overall brain function. This animated diagram shows how chronic inflammation works in the brain. As cytokine levels rise, they actively disrupt normal neurotransmitter pathways. This disruption has a direct correlation to behavioral symptoms. It reduces impulse control, spikes irritability, and causes sudden depressive shifts. For caregivers, this means those hostile outbursts aren't intentional attacks. They are physical reactions happening inside the body. Visualizing this internal inflammation replaces shame and blame with clinical understanding. Step 2 moves us from biology to data collection. We need to set up a daily tracking log. Draw 4 columns in your notebook: date and time, specific behavior, context or trigger, and severity. Record specific, observable actions. Watch for emotional numbness or unusual anxiety or sudden anger. Many caregivers feel guilty writing down a loved one's negative actions, worrying it feels like keeping a scorecard. You have to reframe this exercise strictly as objective medical data collection. You aren't making accusations, you are taking notes on a symptom. By transforming emotional outbursts into structured data, you neutralize conflict at home and build an essential tool for your medical team. Step 3 is putting that tool to work. Bring your completed tracking log to your next scheduled oncology appointment. Patients, present this confidently. Tell your doctor, I am experiencing shifts in my mood and personality, and I need to report this as medical information. Caregivers, you should attend this appointment and submit the objective data log to the doctor directly. Make sure you ask the medical team 3 specific questions. Could this be caused by inflammation? Are these medication side effects? And what specialists can you refer us to? It is crucial to request a direct referral for specialized psycho-oncology services or counseling. Treating behavioral shifts with the exact same urgency as physical pain ensures that mental health gets the clinical intervention it requires. Step 4 focuses entirely on the caregiver. You need to establish specific caregiver support rules to manage your own emotional strain. Always initiate blame-free conversations with the patient, explicitly acknowledging the illness as the root cause of the tension. You also have to protect your own mental health by locating a local support group and scheduling regular respite care. Independent emotional support is a mandatory requirement to sustain the overall care you provide. Look at your notebook. You now have a complete communication and care action plan, detailing the biology, the tracking log, the doctor's visit, and caregiver support. You have moved from feeling helpless and resentful to being proactively prepared. Cancer is a deeply interconnected mind and body experience. Take this action plan to your medical team. Structured communication and objective data are exactly how you successfully manage the unseen side effects of cancer.